it's lovely to be here. First of all, I want to give you a content warning for my talk today. I am going to be talking about some difficult subjects today. I'm going to be mentioning both abortion and domestic violence, and there are going to be images of human remains in my slides. So, if that's not something you're feeling particularly comfortable with this morning, it's a lovely day to go and sit in the sunshine, and that's all right. But I am a human remains conservator. I work up close with human remains on a daily basis. And I often wonder what you would learn about me if you had my human remains in front of you. If you had my skeleton, what would you know about me? And the very, very obvious thing about my skeleton is the fact it's got some metal in it. My ankle is held together by pins and plates. And if you were a diligent researcher, you might look at this, you might see if there were serial numbers on there. And if the records have been kept, you might be able to trace that to me having had those implants put in on the 17th of December, 1999. This was the millennium gift that everyone wanted. And you could maybe combine that with looking at weather reports. You might see that Edinburgh had heavy snow the week before that, and that might lead you to surmise that that was the cause of my injury. You'd be right. You might see some other things about my skeleton. I habitually carry often a very heavy bag on my right shoulder. I know I shouldn't do it, but I do it anyway. And that's probably going to actually show on my spine. Possibly not to the same degree that William Burke has a sort of unilateral damage to his spine. This is likely to come from the fact that he was digging canals before he came to Edinburgh and started killing people. If you looked at my teeth, you'd find more about me. First thing you'd probably notice is that my front teeth are capped. So that might give you some socioeconomic information about me. I'm doing all right. I can afford to do something that's largely cosmetic. But look further back in my mouth, that wasn't a good day. The work is not so well done. So, you might think that, I'm doing okay, but they could pay me a bit better. Or possibly you might think that I'm a bit vain, that I'm prepared to splash out for something that is largely cosmetic, that's actually going to be seen by people and go a bit cheaper when it's hidden away. And again, that's possibly true. This much eyeliner does not apply itself. But if you looked at my teeth, you'd find something about my health. These are my wisdom teeth. They were removed when I was in my 20s. And for those of you who don't see the roots of teeth very often, those black lines along the bottom, they're not meant to be there. And if you had that on your table in front of you and you were trying to figure out what that meant, well, you would infer that this was indicative of illness or possibly starvation that occurred when this part of the tooth was being formed. And that would be roughly between the ages of about 10 and 12 years old. And when I was 11, I was diagnosed with type 1 diabetes. So that's showing on my teeth. And having had type 1 diabetes for more than 35 years, that's likely to show if you've got my soft tissue in front of you. I see it regularly when I get my retinas checked. My blood sugar levels are good, but it's not the same as being non-diabetic. And you'd likely see indications of that on other organs of my body. You'd possibly find things out that I don't know about myself. So these are just some of the things you might find out from examining me with no background at all. And as somebody with type 1 diabetes, one of the things I find is that people are always interested in things in our collection that reflect something about their own stories. So I want to start by introducing you to someone who has type 1 diabetes. This woman, 36 years old, she's taken into hospital with a diabetic coma. And this is just a couple of years after insulin has become available. So they're actually able to do something about that. But of course, having sugar levels that high in your blood, that causes damage to your body. And as well as the coma, they find that she's got sores and infections in her mouth. And so she's in hospital for a couple of weeks. And she can feel something loose in her mouth. And she reaches in and she pulls the contents of this jar out. This is actually her palate. And she hands it to the nurse. And you've got to imagine that nurse probably thinks she's being given some false teeth or something like this. But this is actually this woman's bone that has detached due to infection secondary to type 1 diabetes. And you see this, and you kind of think about the fear that this woman must have felt, what that must have been like to go through. You get some insight into her mind, how this would have been to have this happen to you. This is something that is hasn't been expelled from the body through illness. This is actually something that was removed surgically. And what we have here is a cyst, and it's encapsulating a foreign body. And this actually comes from a woman who discovered that she was pregnant. And she doesn't want to have the baby. And in historical narratives, you often hear a lot of things about the way that people didn't want to have children because they were out of wedlock and the scandal at the time. But we know this woman was married. So we can see from this that, through time, there has always been a multitude of reasons why people might not want to have a baby at a particular point in their life. But for this woman, there is no legal way of dealing with this, as unfortunately for so many women today. And so she takes matters into her own hands. She takes a knitting needle, she coats it in Lysol, and she inserts it into her uterus through her vagina. And she leaves it there. And within a week, she gets the hemorrhaging, which is indicative of the termination of that pregnancy. And she's fine. But then she develops a sort of lump in her buttock, just near her sacrum, and it starts to become really difficult when she sits down. So she goes to see a doctor. And he finds a cyst, he removes it, he recommends surgery, and that cyst is encapsulating that knitting needle that she had left in her body. And again, we know that she recovers well. This is from a woman who was a domestic servant. Again, she's 28 years old, like the previous woman. This jar is teeny tiny, it's not very big. And so she would have been working long hours, difficult work. She was probably used to aches and pains, but the pain in her hip, that's become something else. And she goes to the doctor and she has this tiny little lump removed from a nerve sheath, and that relieves her problem. So this is something ever so small, but it's giving us a sort of insight into the relief that she had. So this is telling us something about the glimpses into people's lives we can get through the human remains in our medical collection. If you combine that with archival research, you can learn even more things. And this is a very, very sad story. This is somebody who was actually murdered in 1831 by her husband. And I always find it really poignant, when you clean the blood up, how tiny that fatal injury is. And I was always really upset when I was reading about her story. Not only is it very sad, but our records only tell us that her name was Mrs. Gow, or James Gow's wife. And with the help of law librarian Jenny Findlay, we were able to find out that her name is Georgina. And being able to give her back her name felt very, very powerful to me. And here at Surgeons Hall, one of the things we're going to try and do is recruit for a provenance researcher who will be able to help us elucidate more of these stories. And of course, the dead are also able to give us something else. They're able to give us conversations which might inform our future. This is one of the things that I'm doing more and more in my role. That I am able to work with researchers who can do things like look at the genetics of the pathogens that people are carrying. And this may inform the way that we respond to pandemics in the future. And that thing that happened a couple of years ago, probably forgotten about it by now, we might see why that is important. Of course, when we're doing this, the collection is more than just, it's more than just medical objects. This is something else. This is actually human remains. This is not just a tool for research. And so I think by looking into the stories, to be able to find out the things behind these people, we're able to give them back some of their humanity, to treat them not just as objects, as is referred to in the title of this conference. We don't get everything. We don't get to learn about their small joys. If you had my remains in front of you, you might know that my ankle aches when the weather is cold, but you don't know the way that I love to cuddle my dog or listen to the sound of the rain. But I still think that this is a very, very, very valuable thing we can do to see into the lives of these people, especially as they're often not the people whose stories are told in our history books. And I like to think about what we're doing here as having conversations with the dead. Sometimes they're difficult conversations, but they are very, very important. You know, they're telling us about themselves, but they're also telling us things that might change our future. Thank you very much.